practitioner based in London in the UK. And today's topic is broken heart syndrome. Sometimes it's called Takotsubo cardiomyopathy. You see, so today we want to understand broken heart syndrome, know the symptoms, the causes, risk factors, and the complications. That's what we're going to go through right now. But now let's have a general overview of what is broken heart syndrome. You see, the name may sound or may indicate that sort of a romantic expression, but there's nothing romantic about this name. It's a real medical term describing a temporary and reversible heart condition whose symptoms mimic those of a heart attack. Because the symptoms are exactly the same as heart attack. That is why in the past 50 years ago, it was misdiagnosed as heart attack. But even now, if you don't have a good doctor, the doctor may diagnose it as a heart attack, and if not careful, you're given treatments as that is for heart attack instead of giving treatment for broken heart syndrome. So it's really very important to know the clear difference. In heart attack, listen carefully, it involves blood flow to the heart, which is cut off. We call an artery, a quite big artery, is called coronary artery, that supplies blood to the heart. But in heart attack, this coronary artery is partially blocked, or it could be really blocked, so it prevents blood getting to part of the heart, so the heart tissue may permanently die or the damage. And so this is heart attack. When it happens, when the blood cuts off, that is supposed to supply your heart, it cuts out, that heart attack occurs. But then when it occurs, you will have symptoms of the same as a broken heart syndrome. But in broken heart, it doesn't involve blood at all. It involves a sudden physical or emotional stress. It's a sudden physical emotional stress. So, example, if you get a divorce that you did not expect, or very painful divorce, it can happen. Or you lose someone that is dear to you, it can happen. Or even good news, sudden good news that you've won a lottery, it can suddenly cause a weakening effect to part of the heart. And that part of the heart, because part of the heart has been affected, the heart cannot pump blood really efficiently into your brain and also vital organs. So it will mimic, or it will copy the same condition as heart attack, right? So I think now at this point we know the clear distinction or difference between heart attack and broken heart syndrome, or sometimes we call it Takotsubo cardiomyopathy. I believe you like this name, Takotsubo. So when you hear it, Takotsubo is a Japanese name for, octopus trapping pot. It's a trap they use to trap octopus. So when you look at the heart, in the machine, and you examine it in the broken heart syndrome, it looks exactly the shape, the pattern is like Takotsubo, is like this trap for octopus. That's why the name given to it, but it's only a point of interest, lovely listeners. But now let's come now to the signs and symptoms. But before then, there's a very, very important point to raise here. Who are affected in broken heart syndrome? You see, broken heart syndrome can affect anyone at any age. But then when we look at adults, it affects more adults than children, right, or teenagers. But when we consider adults, more women suffer from broken heart syndrome. Why? When women are getting into menopause or postmenopause, the hormone called estrogen is a cardioprotector. Normally during the active reproductive period of women, this hormone is quite high. This estrogen increases, so it protects women, and it helps really a lot. It supports blood to get into the heart and get into the body. But when women get into menopause and then postmenopause, this estrogen, this hormone, decreases, and so that cardioprotection is lost. And so that could be now one of the key reasons why most women experience or have this problem, broken heart syndrome. More women, really a lot more women than men, because men don't have these issues with the estrogen, only women. So, now let's come to the symptoms. How would you recognize that you have a broken heart syndrome? You see, as I was saying, the symptoms are exactly the same as heart attack. Now, the first symptom here, let's put all the symptoms together. The first symptom is angina. It means chest pain or discomfort in the chest, and then shortness of breath. Why shortness of breath? Because if the heart is not pumping well, fluid will get into your lungs, and when fluid gets into your lungs, you will see that you will be short of breath. So that is why it's really very important to observe. If you're short of breath, you have to be careful. You have to know that your heart might not be working well. And if you cough, chronic cough, you cough continuously, you've taken all medicines in the world and it's still coughing, it could be that there's a little fluid in your lungs and causing this chronic cough. It could be other more underlying serious problem, but this is one of the reasons I have to tell you, lovely listeners. So shortness of breath, pain in the heart, and then arrhythmias. When we talk about arrhythmias, it means your heart may beat very fast or may beat too slowly. It is irregular heartbeat. That is arrhythmia. And normally in broken heart syndrome, it is typical characteristics that within 1 or 2 months, when you have treatment, you have good treatment, your heart will recover fully. Okay, but not in heart attack. Heart attack, your heart will not recover within 1-2 months. So that's very clear distinction between heart attack and broken heart syndrome. And then of course is that individual may experience low blood pressure. So putting all these symptoms together will let you understand that in broken heart syndrome, recovery is within 1-2 months. If you treat it, you may experience the same symptoms as heart attack. It means pain in the heart, chest pain, shortness of breath, palpitation, all right, and low blood pressure. And you may also feel dizzy because you don't have enough blood getting to the brain. So dizziness will also be involved here. Well, let's find out what really causes, or we talk about the causes and risk factors of broken heart syndrome. But before we bring the causes and risk factors and the complications of broken heart syndrome, let me please put the numbers on the platform. You may not be suffering from any heart condition. Maybe it's someone, a loved one, a good friend. Please share this number, because there are many people suffering and they don't know that there is an alternative for them, and they may be doing the same thing over and over without solution. But even if you had heart failure is a condition that after, even when you walk a few steps, 5-6 steps, you get tired and you sit down. Even in that, we reverse it. We reverse it by God's grace. We reverse it. So don't sit down to suffer in vain. it would be a real shame. When you call in outside the UK, lovely listeners, it's +44 738 464 7300. Calling within London or within the UK is 0738 464 7300. The second number calling outside the UK is +44 745 988 9152. Within the UK is 0745 988 9152. Please just call, a call away, and then you will find solution to a problem that you may think is unsolvable. Everything has a solution. Well, let's come now to the to causes, risk factors, and the complications. Officially, it is said that the exact cause of broken heart syndrome is unclear. But nothing just happens. It's really very important for you to know this, lovely listeners. Every organ in the body needs specific nutrients. That is nutrients from the food. Every organ, the brain needs specific nutrients. The heart needs specific nutrients. So if you don't have good digestive system to get the nutrients, and if you don't have good circulatory system for your blood to carry, to transport this nutrient to the vital organs, to the tissues, it may happen that your heart may be a bit weak without you knowing anything. So when you hear anything shocking, it could be good news or bad news, because prior to that news or that intense emotional stress or intense physical stress, because your heart might have been a bit weak, your heart may not stand it. So in case you have a weak heart because your heart is not receiving enough nutrients, or not sleeping well at night, or not doing enough exercise to strengthen your heart muscle, because the heart is only muscles, and if these muscles are getting weak, you may not know anything. So the heart needs nutrients, exercises. We call it high intensive interval training. High intensive interval training is beautiful exercise for the heart. It strengthens the heart muscles, and sleeping well at night strengthens the heart muscles. And then laughter. You see, laughter gladdens the heart. So if you have a conversation that doesn't gladden the heart, your heart could be weak. So don't talk to people that will suck your energy. It's very important to surround yourself with positive speakers, positive people, that they will cause you to laugh. They will cause you to smile. That's what you need. So it's not everything about nutrition. It's about what you hear. It's so important for you to have good heart. And a smile on your face every day can strengthen your heart. I tell you, the human body is so complicated. So there are some things you don't see, you cannot touch, but it gives you health. And that's what I'm sharing with you today. So you see, if you don't do all these things, and then there is a sudden information that will trigger this broken heart syndrome, because broken heart syndrome is always preceded by intense physical or emotional stress. And some of the stress, as I told you already, the death of a loved one, a frightening medical diagnosis, domestic abuse. You may see that a situation that wife is abusing the husband, or the opposite, husband abusing the wife, or even children. When it goes on and on, this can be a real problem. Losing, or even winning a lot of money suddenly. or losing money financially, or losing your job suddenly, or a painful divorce can cause this problem as well. There are also medical conditions like asthma attack, or this COVID, these viruses. They can really cause damaging effect on the damaging effect to the heart muscles or the heart tissues. There are some drugs or hospital medications that can contribute to broken heart syndrome. Drugs that are used in severe allergic reaction or asthma attack that they give to people can cause, or they can contribute to broken heart syndrome. Drugs that are used to treat nerves problem, especially those that they have diabetes for a long time, that their nerves are damaged, so they go to the hospital and they are given a treatment for those nerves. And this treatment for the nerves in diabetic condition can contribute to broken heart syndrome. And also drugs that are used from the hospital to treat thyroid disorders or thyroid gland, like overactive thyroid or underactive thyroid, that is hypothyroidism or hyperthyroidism. It can also contribute to broken heart syndrome. So as I'm saying, who actually gets broken heart syndrome? I said it can affect anyone at any age, but especially adults, and among adults, women, because of the estrogen I was talking about, this hormone. Especially women get into their menopause or post-menopause, their heart is not strong. If you are getting into menopause or you are in post-menopause, I have to let you know that you need to strengthen your heart, because your heart is not strong. And if you have a husband, you have to advise a husband to really deal with you sensitively. It's very, very important. But above all, we have to strengthen the heart. There are nutrients, there are herbs that strengthen the heart muscles, not to just waste away just like that suddenly. Because research has shown that broken heart syndrome can kill, definitely can kill. Anyone above 40-45 is also at risk. And then individuals with neurological conditions like epilepsy, or those that have experienced seizures before, it can also be a risk factor. And those that are got, or they have experienced their previous psychiatric disorders, it's also a contributing factor, or it can be a risk factor. Now, what are the complications of broken heart syndrome? You see, the first complication here is that, you see, the heart consists of 4 chambers. The pumping chamber, the left side, we call the left ventricle, is the main pumping chamber that pumps blood throughout, to the brain and to the rest of the body. The right one pumps blood mainly to the lungs, right? But the left side of your heart, the down, is called the left ventricle. It pumps blood to the whole body, to your brain. In broken heart syndrome, this part is affected, and when it's affected, it means it's weakened. And if you're not careful, if you're not treated to restore the strength of that area, that muscle there, then that muscle can continue to be weak, and then you may be there nicely dressed, but the pumping capacity, or the pumping effect of the heart may be running at maybe 60%. Also, it means that the amount of blood flowing in your body may be reduced by even 40% without you knowing anything. So you may feel healthy, but your health may be waning, slowly going down, because if the kidneys, the liver, your brain, these vital organs are not receiving enough blood, because that area is weak and it's pumping, but it's not pumping efficiently, all these organs with time may malfunction. They will not work well, and you may not understand, and you may start producing symptoms, and then you will start to go to hospital and treat the symptoms, and forget about the underlying problem that may be your ventricle. The main pump of the heart is not working well. So that is one of the key complications. But then in broken heart syndrome, lovely listeners, it can contribute to clotting of blood. It can can contribute to blood clots. And this clot can travel from the heart to your brain. And if the carotid artery, this is the artery or the blood vessel which actually carries blood to your brain, and if that artery is narrowed because of plugging or atherosclerosis, this plugging of the arteries, then it can cut off blood getting to your brain, and that can lead to stroke. Right. So you see, broken heart syndrome through that can lead to stroke. If a person experiences broken heart syndrome and that individual's arteries are not free, it can lead to heart attack, or it can lead to sudden cardiac arrest and death or stroke. So this is some of the complications of broken heart syndrome. But then another interesting frightening complication is what they call cardiogenic shock. The cardiogenic shock is a life-threatening condition where your heart suddenly stops pumping. It suddenly stops pumping. So your body will not receive enough oxygen with nutrients. And so some vital organs may be affected, especially the brain. And if oxygen is cut off to the brain, it could lead to coma, and then death can come. So research has shown that broken heart syndrome can definitely kill. So we shouldn't joke with that. I'm not here on this platform to frighten anybody, but I'm on this platform to give you true knowledge, to tell you the truth. And sometimes telling the truth can be a bit frightening, but if you know the truth, it will set you free. Please visit us on YouTube channel. Put in Dr. James Natural Link and like us, please. Subscribe so that you don't lose any of this program at all. If you continue to listen to us or listen to me, your life will never be the same, because ignorance is the biggest enemy in the whole wide world. Gain knowledge today, and your life will never be the same. So today we know heart attack versus broken heart syndrome. Heart attack involves blood cut off to the heart. Broken heart syndrome doesn't involve blood, but it's a sudden, intense, emotional stress or physical stress that can cause this problem. We know the difference now. Thank you very much for listening to me, and please share this presentation when you have the opportunity and be a blessing to someone. Thank you very much. May you be a blessing to someone as well. Thank you. I look forward to having also another time with you. That is the coming Thursday. Blessings to you.
I am the God that healeth thee. I am the Lord, your healer. I sent my word and healed your disease. I am the Lord, your healer.
The first development of diseases is in the cell's tissues before they get into the blood, urine, and stool. Diseases do not start in the blood, so if you are waiting for the test of your blood cultures, the results will be only a confirmation of a well-developed diseases. Remember, had I known is always at last, hence why I'm recommending Dr. James Natural Link Sector for you. We have latest smart machines which is used for diagnostic assessment to determine determine the condition, the root cause of your condition, and even what is about to occur in the body from 6 months to 1 year. Dr. James is an experienced natural medical practitioner, gerontologist, and health educator. He graduated from a renowned Canadian institution and practiced in Europe. We offer many natural therapies like detox, pain management, skin problems, weight loss, anti-aging, and more. We give advice on dieting for all medical conditions. With over 20 years of experience, NaturalLink can naturally help you support your body cure itself of diseases such as blood pressure, diabetes, arthritis, stroke, kidney and liver diseases, prostate enlargement, asthma, allergies, hair loss, male and female infertility, cancer, and more. Yes, seeing is believing. We will use smart machines to generate all hidden conditions and help you break free from all diseases. Call us on 07384 647 300 or 07459 889 152. Address 9 to 11 Gunnery Terrace, Woolwich Arsenal, London, SE 18 6SW. Email holisticforall@gmail.com. They say prevention is better than cure, but we say prevention is better than intervention. Dr. James NaturalLink, purely natural, getting well naturally.